hopefully this will go through. Uh, Medical professionals and the public, and shedding light on the clinical treatment. Today, in recognition of Breast Cancer Awareness Month, we are diving into a conversation male breast cancer. My guest today is Phil, a survivor who is left while playing with his child. Between the ages of 60 and 72, but awareness is and free of and awareness. Let's see.
I'm getting a lot of breakup on your video and sound.
To your healthcare regimen. A little bit about yourself and how you first discovered a lump under your breast.
Hi, Joanna. I want to make sure everyone can hear me because I'm struggling to hear you. It's breaking up a lot. Can you hear me? Can you hear me, Joanna?
Yes, I can hear you. Can you hear me?
Well, it keeps going in and out, so if I don't hear, I'll have to ask you to repeat the question. But yeah, so it's froze again. No. So I'm okay. It's just it is breaking up a little bit. So yeah, 2016, I was playing with my daughter, and she elbowed me in the left chest area, and later that night I discovered, or I felt something which wasn't normally there, which was pea-sized lump directly behind my left nipple. And and I didn't worry instantly about it. I just thought I didn't imagine what it was going to be. I just kind of thought I'll get to the doctors, and that was a Sunday afternoon. And Monday morning, I went straight to my GP in the UK, which is where I live, and got examined. And again, nothing was mentioned, but they put me into the UK's 2-week breast screening program, which basically is a screening program that is for anyone that has a suspicious lump in their breast. So I was like, right, okay, it's a suspicious lump. Let's get it checked out.
Mm-hmm. So, sure.
Sorry, say that again.
So, was there any color change to the lump? Was there?
So it was a very, very small pea-sized lump. It wasn't painful. There was no discharge. There was no rash. There was no inverted nipple. It literally was just this random, the tiniest of objects directly behind the nipple. There was no other symptom at all.
Mm-hmm.
Oh, you through.
Well, you found first felt the lump. Did you have any ideas that men could get breast cancer?
I mean, it's hard to travel back in time and give you an accurate answer, but I think I'd actually heard of. Looking back, I think I knew Montel Williams, the chat show host in the US, had been diagnosed, and I think that sprung to mind once I found out I had breast cancer. So, but at the time, I didn't instantly I didn't instantly link a lump in my breast to breast cancer, which sounds like the weirdest thing to say, but I just didn't instantly think cancer. I didn't instantly think anything. I just thought, I don't know what that is. Let's just get it checked out. And it was only a matter of 10 days later, because I was seen so quickly and went through the screening program, that they said, yeah, we think it's probably cancer. So that was 10 days later after I found the lump, which is it's just a crazy short period of time to be told that.
Um, so, um, how you did it take? So you said it take 10 days.
Yeah, so I mean, obviously in the UK, you are normally seen within 2 weeks. That's the aim of the NHS in the UK, which is absolutely amazing. And where anyone in the UK that finds a lump, to be seen that quickly could basically save their life. So I'll always be grateful for the speed that um, I was seen. I know one of the problems with, obviously now I'm 8 years into my diagnosis. I know that one of the problems when it comes to males, and I would imagine this is in the same in the US and in the UK, is that firstly the man might not even go to the doctor. Secondly, the doctor might assume that it's nothing serious. So a lot of what I've read has told me that with men they'll get diagnosed a lot later in their kind of like in this development of the cancer because of things that can stop them from being seen as quickly. I mean, again, I think I was very very lucky because I got it checked out the next day, and then the doctor put me immediately to be seen by obviously the women's unit, the breast unit, which is local to me. Which I mean, basically, I can't say it saved my life, but it definitely improved the prognosis for me because it just happened so quickly. But obviously, that came with its own set of problems. In that, to be told you've been that you have cancer, it's not something that you normally expect to happen on a normal day of the week. So that had a bit of a mental impact on me, and it's something I took a lot of time to kind of process. And now I just want to kind of like give back, raise awareness, obviously tell men and women, young and old, any gender, any race, that this is a thing, and you need to be kind of like aware of your breast health, be aware of what your normal is, and obviously get to the doctors as soon as you see any change, or if you have any concerns, the professionals will put your mind at ease. And if they don't put it at ease, they will deal with it. So either way, I kind of recommend people to get to the doctors as soon as they possibly can now, as a way to potentially save someone's life.
What was the process like? Could you can you?
Yes, yeah. I mean, it was just so quick. So, like I say, I found the lump. Less than 2 weeks later, I went for a mammogram. physical biopsy and ultrasound. That day they told me on a scale of 1 to 5, it's a 3 that it's likely to be cancer, which is obviously the shock of your life when someone says that to you. Um, I had to wait a further 2 weeks for the biopsy results. So that was 4 weeks after me finding the lump. I then got told it definitely was cancer. I don't know whether they actually said it. They told me then it was grade 2 cancer. I'm obviously now I know that it was grade 2. Well, I mean, all I was told, my nurse just said, this is an aggressive cancer. If we don't get it out of your body as soon as possible, it could be, your future, your future could be completely different. So I was like, yeah, okay. And then they gave me a date for surgery, which was 4 weeks after that. So theoretically, from finding the lump to having it removed, I mean, at that point, I didn't know I was totally cancer free, but that was 8 weeks. So incredibly quick, like incredibly quick. And then I had a further 2 weeks to wait for the. I had a biopsy of my lymph nodes in my armpit to see if it had spread and to see if I'd need radiotherapy or chemotherapy, and that came back negative. So I didn't have to have. I just had surgery, and then they put me onto a hormone blocker called tamoxifen, which, if you're in the breast cancer community, everyone knows and has heard of tamoxifen. It basically it blocks the estrogen production in whoever takes it. So my cancer more than likely was caused by a hormone imbalance in my body. And that was it. It was super quick, 8 weeks almost from start to finish, 10 weeks if you include the lymph node biopsy results. And yeah, then I got spat out the other side and had to carry on with my life, which is it's an unusual situation to be in.
Mm-hmm. But how did your healthcare team handle handle?
Yeah, well, I mean, they weren't surprised. I mean, they seem to be taking it in their stride. I think they adapted it a little bit for me being a man. They did tell me at the time that they have about 3 men a year kind of come in and have surgery. So, it isn't something that is completely unique, but obviously it's not a thing that they deal with on a daily basis. Um, the only real thing that they consciously had to do was when I went into hospital for surgery, I had to have my own room because obviously I couldn't be on the ward with women who were also having surgery. So they just said, that's the unit where we do our breast surgery, but you'll have your own room. Um, I think the surgery took a bit longer than what they expected, but I don't know whether that was down to they appeared to make an extra effort to keep my scar size really, really small. Even though they've gone into my armpit, the scar is absolutely tiny. So I don't know whether that was something they were trying to do, is keep the scar size as small as possible. So I was told when I woke up that the surgery had took a little bit longer than what they thought. But I mean, it was a tiny. I think they told me it was 32 grams had been removed, which is like nothing compared to if a woman has surgery. Um, and then I think other than that, it was the operation and the procedure and the treatment I got is exactly the same for men and women, regardless. Regardless.
What treatment did you undergo? Emotionally.
Yeah, so obviously I had surgery, so I've had a mastectomy, and I had 3 lymph nodes removed and a sentinel node biopsy. And then as I left hospital, they gave me the tamoxifen, and then I had to go and speak to my GP, initially for pain relief, and then to get an ongoing supply of tamoxifen, which I didn't know at the time, but I went on that. I carried on using that for 5 years. A lot of women that have breast cancer, tamoxifen, well, actually, men and women can be on it for 10 or even up to 15 years. As regards kind of how did it affect me, the tamoxifen did make me incredibly tired. I was quite lethargic a lot of the time. Um, I used to get a lot of leg cramps. Um, the my my gums in my mouth aren't the same as what they kind of like used to be, which is something I didn't think was going to be a thing. But I've spoken to someone, my nurse my nurse after the event, and she said that she'd never heard of that before. But I've spoke to people about tamoxifen kind of side effects, and a lot of people will whilst on tamoxifen will ask to be put on a different brand, or they'll ask whether they can actually come off it because of the side effects can be like so horrendous for different people. I've heard of people's teeth crumbling, bone pain. Um, it can bring on like hot flushes, like a menopausal kind of reaction. So I mean, I was in pain occasionally from leg cramps, but I kind of like worked through it, and it wasn't something I wasn't able to manage. And then the pain in my from the surgery, and it kind of wore off after about 3 months. So I kind of was just on painkillers for nearly 3 months just to kind of like manage that. But it was, yeah, there wasn't anything too horrific. Even when I got the dressing removed off my scar, I thought, oh, is this going to be upsetting for me? But I was like, nah, it's fine. It's kind of like, obviously I've got no nipple now, but it's absolutely fine. It's something I can live with.
Yeah, mastectomy.
Yeah, so I had a mastectomy on the left-hand side and a lymph node biopsy to see if I was going to have further treatment, which luckily I didn't. Oh, and I did touch on the emotional bit. Your screen's gone. Hello, Joanna. I don't think you've got a very good signal. Just going to keep on talking. So, like emotionally, um, it was pretty difficult or rather, being told that you might have cancer was the bit where the night before it was confirmed that I actually had cancer, I kind of like went a little bit off the rails, and I ended up ringing a support helpline in the UK, and I had to talk it through with someone that wasn't kind of close or connected to me, just to clear my head, and that was kind of like my little blip um, just before I found out. But other than that, I was in a relatively good headspace. I did go in to a drop-in kind of like counsellor service in the UK called Maggie's, and I would just go in and just to get to be in a slightly different environment, have a chat with someone, have a nice cup of tea, and just kind of just take the stress off my mind, um, which went on for a while. So yeah, Joanna, you're frozen completely now. So I don't know whether
So,
to.
can you still hear me?
Yep.
Okay.
Yeah, I can see. It's okay.
Looking back, is there anything you wish you would have known or done differently in your journey?
I mean, it would have been nice to have known that it wasn't going to be a life threatening situation. But of course, at that point, it wasn't decided. Um, the maybe the thing that needs to be explained to people that is when you get a breast cancer diagnosis, primary breast cancer on the whole, if you catch it early enough, does not kill you. And that's probably something that the general population needs to know, that it's not nice having surgery, but the reality of primary diagnosis is that you're definitely going to have surgery, and then depending on the stage, you may have further treatment. And on the whole, you can survive it. It's not primary breast cancer isn't something people die of, and it's not. That's a statement that a lot of people don't want to or don't say often enough. And that's not to belittle the the journey of someone that's going through primary breast cancer, because I think just the shock of it is hard enough. Um, Now I'm more knowledgeable on the ins and outs of what a diagnosis actually means, and for me now it's kind of like reoccurrence is the thing which I've got to be super aware of. And within the community we all kind of like remind each other that you've got to check your other chest, and just be kind of like body aware and know you're normal. And yeah, just we are educating the community is educating itself as regards recurrence, and then the community hopefully can get out of the community and educate people that aren't chest aware, don't check themselves, and don't have the knowledge to say, if I find something different, go to the doctors and get it checked out.
Just been diagnosed with.
Oh, say that again. Was it how much? I can't hear anything. The next question down, which I've not answered, was the support group question. I don't know whether you're asking me that, but I don't know if I just go ahead and answer that for you. Um, there was a male support group, but one of the counsellors I spoke to had said it wasn't suitable for me because it was mainly um, talking about chemo and radiotherapy. So that was kind of taken away from me, and then she suggested maybe going to a support group for people that had been diagnosed and been treated for skin cancer. But in the end, I decided I didn't. I'd kind of like go it alone and just kind of um, try and find my kind of like place in the community without the help of the counsellors setting everything up. And I kind of just kind of like tried to go back to my normal life, but then decided what I would actually do is just kind of go online and share my story. So I ended up going into a few newspapers, and I thought, well, maybe this is kind of like could be like therapy for me. It could be me sharing my story with the general population with the aim of like potentially saving someone's life. Um, Whether I've done that or not, I don't actually know. I'm 8 years on now. I keep sharing my story. I reached out to you, and I reached out to many podcasts just to get in front of as many people as I possibly can, and just say, this is a thing. And until people see a bloke standing in front of them saying, men get breast cancer. A lot of people don't even know, and so there'll be like husbands, brothers, fathers that need to just be aware. And if a relative, a female relative, happens to tell the male, um, this is a thing, it could potentially save someone's life. So that's kind of like what I've been doing for the last 8 years. Um,
How did you communicate the diagnosis with your family, especially your child who was with you at the time?
I mean, that's hard. That is probably there, because I went to the appointment on my own and obviously spoke to the doctors on my own. Telling my partner at the time was probably one of the most upsetting things I've had to do, and that obviously that kind of like when you actually tell someone those words, it kind of makes it incredibly real. So that wasn't very nice. My daughter was at school, and at the time, my daughter was very very young. She's actually disabled. My daughter, so even now, 8 years on, she still doesn't actually understand my diagnosis, and she still doesn't understand that she potentially saved my life. She's actually been incredibly she's been incredibly good therapy for me to just kind of like not sit and wallow, and to just get out there and have fun and don't worry about things. And yeah, she's a breath of fresh air. Yeah, she's been amazing, my daughter. Um, what
Differently in
message?
your journey? See, looking in your journey.
Yeah, so obviously you I think you've asked me that already, but yeah, it was just kind of like to say I wish I could go back to and speak to myself when I found the lump and just say, look, this is going to be fine. This is going to be a positive change in your life. This is going to be a positive influence. This is going to change your life for the better. This isn't something to stress and worry over. And, you know, all of those things have been all completely true, but on the assumption that I got to the doctor as soon as possible. And that applies for anyone that finds a lump. So, you know, don't sit and wallow in shame or guilt or worry. Get to the doctors and let them eliminate it or confirm it, and that will make you know one way or another if it's anything serious or not. So yeah, I mean, it's very easy to say, but yeah, don't worry. Like, don't worry about things. They'll work out how they're supposed to.
So I think I asked this one before too, but I don't know if you heard it.
What advice? Yeah. So depending on where you are if you're newly diagnosed, what I did was I reached out to a local charity called Breast Cancer Now in the UK, and they partnered me up with a peer support buddy, which was another guy who had had breast cancer and survived. He'd had it in 2012, and um, so that would have been 4 years previous to me. And yeah, having someone as a role model to look at and go, this guy survived it. Everything's going to be all right. Was incredibly helpful. And I think if you can get into a community or support system or a network of people where you can see people are survive it and are further on in their journey, and that's where you will be one day, then the best advice I can give people is to kind of like reach out. And also, you know, I met people that didn't want to share their diagnosis, which is a personal choice. Um, on the whole, people know, even now, if I tell them that they're supported, that's 8 years on, and 99.9% of the time, people are super supportive, and there's nothing to be ashamed of. We're talking about biology. This is just something that your body has decided to create. It's not something that potentially you've done. It's just one of those things, and there really shouldn't be any shame about having cancer. It's a time in your life where you need support, you need help, and you should be able to receive it, and you should be able to kind of like, you know, share how you're feeling and feel like you're supported and feel like you're heard, regardless of your gender. And that's a message now that I really kind of like try and put out there.
Uh,
I mean, that's the last question there, Joanna. If that on the list I can see.
uh, I hope you found it insightful and that it encourages more people. If you please consider subscribing to my YouTube channel, Rare Stuff, podcast, and your favorite platform. Also, connect, follow us on X, formerly.
And you can follow me on Instagram. If people want to follow my journey on Instagram, I'm doing loads of daft stuff after my diagnosis. It's at Phil Aldo on Instagram. You're very welcome. And if there's any men out there who want to reach out, that's where you can find me.
Okay.
There's not as much on my YouTube. I'm uploading podcasts at the moment. Oh, bless you, Joanna. Thanks for letting
Yeah.
me come on.
Sure. Let's see. Exciting news. Looking for passionate people. Fundraising experience. Uh, and commit to the serving. I'd love to hear. I'd love to hear from you. Let's see. The opportunity to lead committees. Um, while this is um, it is a fantastic chance to gain valuable experience. Future roles. If you're interested, please contact me at jball@rareconnection.org. Before we take a moment to um, share some important information. Is struggling with. Please know that you're not alone. Is available. You can call 988 for the suicide and crisis lifeline. Or in the UK, you can call 116 123. If you're watching the video version, leave a comment below. Listening to the audio version, you can reach out through the platform. Reviews are also always welcome. And for listening, and until next time, take care.
Thanks, Joanna. I'm really struggling to hear you, but